Okay, somebody's saying something. Yeah, I can't hear you, Tazbil, but I mean, it's okay. You guys can, happy Thanksgiving. You can post in the chat if you'd like, but I definitely can't hear anybody. Maybe it's me. Let me see. Okay. Um, I'm not gonna turn my camera on, you guys. I look like haggard today because I just got out of bed. All right, so autonomy is respect clients' ability to make decisions about their lives. Beneficence, hopefully I said that right. Work toward the well-being of clients. Non-maleficence, I definitely remember that term. Avoid actions that could harm clients. Justice, provide equitable care free from bias. Fidelity, honor commitments and maintain trust. Veracity, be honest and transparent in all professional dealings. All right, can somebody, y'all need to not be shy, please, because I can't hear anyone right now. Can somebody read this slide for me?
I'll read
Please.
it.
Thank you.
The counseling relationship. Informed consent. Counseling must provide clear, comprehensive information about the counseling process, including potential risks and benefits, fees, privacy policies, and the limits of confidentiality. 2, consent must be obtained in writing and revisited as necessary, especially when circumstances change. 2, confidentiality. 1, ensuring client information remains private is a cornerstone of ethical practice. 2, exceptions include cases of imminent harm, child or elder abuse, and legal mandates. For example, subpoenas. 3, dual relationships being a counselor and a friend must be avoided if they can impair professional judgment or harm the client. 2, if unavoidable, for example, small communities, clear boundaries must be maintained. 4, boundary setting. Boundaries protect both the client and the counselor. Examples include avoiding personal relationships, not accepting significant gifts, and refraining from physical contact unless culturally appropriate and client consented. 5, termination. Counselors must terminate services when the client no longer benefits or if the relationship poses risks, as well as provide referrals or resources when ending services prematurely.
Cool, thank you. Yeah. I'll read this one. Limits of confidentiality. Clients should be informed when confidentiality may need to be broken, harm to self or others, abuse in reporting. So I'm sure you guys know from wherever you're working right now, you have to tell them everything, everything in this room is kept confidential unless a child, an elder is being abused, or you say you're going to harm yourself or someone else. You guys with me?
Yep.
Okay. Counselors must document any disclosures made under these exceptions. Record keeping, maintain accurate, secure, and timely records. Adhere to organizational, state, and federal guidelines for record retention, HIPAA. They're not going to ask you state-specific questions, you guys, on the test, so don't waste your time looking that up. Remember, it's a national counselor exam. Third-party requests, written client consent is required before sharing any information, even with family members or other professionals. Electronic communications, use secure platforms for emails, telehealth, and data storage. Inform clients about the risks and limitations of digital communication. Can somebody read this slide?
I can.
Okay, cool.
It says competence. Counselors should only provide services for which they are qualified based on education, training, and experience. Seek supervision or consultation when dealing with unfamiliar areas. Continuing education. Stay updated on the best practices, new research, and laws affecting counseling. Engage in lifelong learning through workshops, certifications, and peer consultations. Non-discrimination. provide equitable care regardless of a client's background, i.e. race, gender, age, sexual orientation, disability. Be aware of personal biases and seek to mitigate them. Impairment. Counselors must recognize when their physical, emotional, or mental health interferes with their ability to help clients. And take necessary steps to address impairment, including seeking therapy or taking a temporary leave.
Great, thanks. All right, collaboration. Work with other professionals, psychologists, social workers to provide a comprehensive care. We also have to have a release of information on file, so make sure, we can't just collaborate unless the client has allowed us to share information, right? Respect each other's expertise. Avoid publicly criticizing colleagues. Address ethical concerns with colleagues through appropriate channels. Basically act like an adult, you guys. Referral, if a counselor lacks the necessary expertise or faces a conflict, they must refer the client to a qualified professional. That's one thing that somebody told me before I took the test that really helped me was when you're talking about substance abuse stuff, guys, you're like, most of the time the question is going to have an answer that says refer out. So be aware of that. Like, substance abuse generally requires a more intense type of care than just seeing a counselor once a week or twice every other week or something. Make sure y'all mute your phones, please. Okay, if a counselor, so I'm gonna read that again, it's important. If a counselor lacks the necessary expertise or faces a conflict, they must refer the client to a qualified professional. Ensure the referral process is smooth and supportive. So you're actually like probably giving them an IOP or an inpatient center they need to go to or an actual LCDC. Informed consent. Explain the purpose, process, and potential outcomes of assessments. Ensure clients understand how results will be used. So you're always, when in doubt, you're always going to give informed consent, right? Cultural sensitivity. Use assessments appropriate for the client's cultural and linguistic background. Be mindful of cultural norms and biases in interpreting results. Use of assessments. Only administer assessments for which the counselor is trained and qualified. Use reliable, valid tools that fit the client's needs. Release of results. Share assessment results with the client in a way that is understandable and supportive. Obtain client consent before sharing results with third parties. Definitely look at this last one, release of results. I do remember people talking about those kinds of questions. So make sure when you're reading the ethical code, just make sure you read the ethical code, you guys, and get way more into detail than I'm getting today. Your future self will thank you. Can somebody read this slide?
I can.
Okay.
Supervisor responsibilities. Supervisors must monitor, supervise clinical work to ensure ethical and effective practices. Provide constructive feedback and foster professional growth. Student and trainee rights. Clearly outline expectations, evaluation criteria, and roles. Support students' development in an unbiased, respectful manner. Boundary setting. Avoid dual relationships with supervisees, social or romantic. Maintain professional distance while fostering a supportive environment.
Thank you.
Welcome.
Do you want to go ahead and read this one too?
Yeah, that's fine.
This one is about research and publication specifically, you guys. Go ahead.
Informed consent. Participants must understand the purpose, risk, and benefits of the research. Participation should be voluntarily with the option to withdraw at any time. Confidentially. Protect participant identities in research and publications unless explicit consent is given. Plagiarism. Credit all collaborators and sources accurately. Accurate reporting. Present findings honestly without fabricating or manipulating data.
Well, thank you.
Welcome.
And this is gonna be, not sure how much of this will be on the test, but anyways, this is about distance counseling, technology, and social media. Maybe the social media stuff, right? They do like throw that down our throat. Informed consent. Explain the risks and limitations of telehealth services. Include details about encryption, security, and potential technical issues. Confidentiality. Use secure encrypted platforms for all communications. Inform clients about data storage policies. Boundaries. Avoid personal interactions on social media with clients. Friending on Facebook. Maintain a clear line between personal and professional online identities. Competence. Complete training in telehealth before offering such services. Stay updated on technology-related laws and best practices. Okay. We are going to do a little quiz. I made a new quiz. Let me find it. One moment. Okay, guys, so y'all know the drill. I'm gonna read it out loud. I did as best as I could proofreading these questions. So if one of them's wrong or something, we can work it out. I think it's 15 if I'm not mistaken. I just gotta find it here. Nope, that's not the right one. So y'all can say it out loud or put it in the chat. Just make sure that I read the whole question first so that we don't impulsively pick an answer when actually it's 20 questions, you guys. So here we go. Make sure y'all let me read the whole question out loud before we just go yelling the answer because we need it. Some people need a little bit longer to process. Also, I think if y'all were on the Zoom yesterday, if we impulsively pick an answer and we're not reading all the choices, like one answer could be better than the other, and that seems to be the case with ethics for sure. All right. Okay, cool. If anyone has anything to say or a situation that comes to mind that we can use as an example to help others learn this, some of this stuff, then make sure you speak up. All right. A client informs you that they plan to harm their neighbor, but insists they won't act on it. How should you respond? A, maintain confidentiality since no action is imminent. B, report the threat to authorities immediately. C, discuss the situation with the client to assess the seriousness of the threat. Or D, document conversation and take no further action. What do y'all think? Yep, everyone's saying C. The answer is C, you guys. Okay, cool. If anyone thinks it's anything different, please speak up so we can all help you understand. You receive a request from a client's attorney for their records. What is your first step? A, provide the records as requested. B, refuse the request due to confidentiality concerns. C, obtain written consent from the client before releasing any records. D, call the attorney to verify the request. I don't actually know if I like this one either. Yeah, the answer is C, but it's annoying because I feel like anyways, yeah, the answer is C. Good job, you guys.
Hey, Tessa, I was going back and forth on C and D personally.
I actually was too. Again, you guys, I use AI to make it and I make these quizzes by myself with them. So sometimes I'm like, I don't know if I like it or not. The answer is C, but like where I work right now, you guys, a private practice, right? Like if we get a subpoena, we don't call the client and tell them, we just have to give the records. Like
Right.
you
Yeah.
can tell on a subpoena if it's a valid from the court or not. Does that make sense? So I'm guessing the question is like an assuming it's a subpoena, you know? I'm not sure.
I think because it's
Or actually,
therapeutic records,
maybe it's the opposite of what
that's
I'm
the
saying.
difference.
Go ahead, I'm
But
sorry, I didn't mean to interrupt you.
I said I think that since it's therapy records, somebody's personal information, that's why it's different with them, why you have to have the written consent, even though you do have the subpoena.
This is Fallon. I was thinking subpoena and attorney calling is two different things, just because the attorney might try to call to go around a subpoena. That's what I was thinking.
You know what? You know
Because
what?
they might try to call, even though it's not a subpoena, just to, no offense, because you know the lawyers are sometimes the bad guy
For
seen
sure.
it. And so I was thinking they may try to call before getting the subpoena.
And I actually just did exactly what I tell you guys never to do. Reading more, I did. Reading more into the question that is there. It does not say subpoena. It's just a request from a client's attorney for the records. And if that is the case, right, nowhere does it say subpoena. It's just a lawyer, which we do get this where I work. And as soon as we get those requests from a lawyer, we call the client and say we need written consent. So, my bad for assuming that a subpoena was the case. This is not a subpoena. It's just a random attorney, right? Requesting records. Okay, well, what would
Gotcha.
you call the client? Some attorney is requesting your records. What do we do? Okay, yes, you can do that. Here's your written consent. So my fault. I just took us down a dark path for no reason. So learn from what I just did, you guys, and don't put more in the question that's there. You guys see what I'm saying? Everyone clear?
Yeah.
Okay, cool.
I have a
love those-
quick question.
Sure.
I'm not looking at it, so I'm just trying to listen. So
Okay.
it wouldn't be C, since you said you read more into
Yeah,
it, because
no,
I
I
can't
was-
really.
I just did the classic overthinking it. So like,
Okay.
so with ethics, I don't know if this will help anybody. Somebody said this the other day and it really resonated with me. Literally visualize the situation playing out. I'm sitting at a
Oh.
counseling office, right?
Mhm.
We get an email, which happens all the time, from an attorney. Hey, we need the records for this patient. I'm reading the email, so I'm watching myself read the email. What do? I call the patient. Is this true? Is there a lawyer wanting records? Right? So I just don't assume. Right? We would definitely not call the attorney to verify the request, because if we called the attorney and verified that was like, that even seems like we're verifying that they're a patient, and that's going to violate HIPAA, right? All right. Is everyone good on this one?
Yeah.
Okay, we actually have 20 questions, so we're getting there, guys. We got this. A 16-year-old client reveals they're experimenting with drugs, but asks you not to tell their parents. What is your ethical obligation? A, break confidentiality and inform the parents. B, maintain confidentiality and discuss the issue with the client. C, refer the client to a substance abuse counselor. D, encourage the client to share this information with their parents. So keyword also, guys, is experimenting. They're not like doing heroin 24/7, right? Okay, let me see in the chat. What do y'all think? Yes, the answer is B. I feel like we had some of these the other day, guys. The answer is B. Maintain confidentiality and discuss the issue with the client. The places where we break confidentiality is if they're being abused or they're going to harm themselves or others, right? Don't like, just because they're a minor doesn't mean they don't have the same, confidentiality stuff that we abide by, except for, again, if they're going to harm themselves or someone else, you really shouldn't be telling their parents everything so they can trust you, right? Anyone else want to speak up why they chose a different answer? Okay, here's the thing, guys. Ethical obligation should be the key word. So D is correct, right? But when it's asking for ethical obligation, is to maintain confidentiality. Does that make sense, you guys? If it didn't ask what the ethical obligation was, if it just says, what should you do? D would probably be the better answer. But it's specifically asking you, what is your ethical obligation? Is everybody with me?
Yep.
Ethical obligation is to maintain confidentiality. Okay, cool. It's kind of hard for me sometimes to read the chat and maneuver. If you guys want to speak up, you can. Okay, 4, during a counseling session, your client mentions they had an inappropriate relationship with a former teacher. What should you do? A, report the teacher to the school administration. B, maintain confidentiality and process the client's feelings. C, investigate further to determine the details of the relationship. D, contact the teacher directly to address the concern. And again, guys, we're not reading too much into this.
B.
Yeah, it's definitely B. So I know when I read this question, I think we had this might have been the same quiz I did like 2 weeks ago. Honestly, you guys, my first mind, like my anxious mind when I was taking the NCE probably did mess up on some of these. My mind reads the question like it's a minor, but it does not. I mean, it could be a minor, but it doesn't say that it's a minor in the question either. So we don't know enough information, right? But again, ethically speaking, we maintain confidentiality and process the client's feelings. Now, if the question were like a 15-year-old is sitting in front of you and they're telling you that they are having a sexual relationship with an adult teacher, what do? That's different. That's sexual abuse, right? But the question does not give that specifics. Is everybody with me?
Yep, I'm with you.
Okay, cool. Anyone has any thoughts, please don't take what I say as like being always right at all, just because again, we're working through this together, guys. 5, client asked to connect with you on social media. What should you do? A, accept the request, but keep interactions professional. B, decline the request and explain professional boundaries. C, ignore the request and take no action. D, create a separate professional profile for client interactions. I think we had one that was similar to this the other day, you guys, and like there's technically, think about it, there's technically 1 or 2 that are right, but which one is the more right? We definitely, in my mind, would not want to ignore the requests. That seems unprofessional. Like, remember, guys, act like an adult, right? We don't just ignore and ghost people. We give explanations. I'm being serious because I feel like people don't, and they're my age and they're 40, and it's like, please just communicate, please, right? So everyone is saying the answer is, yeah, the answer is B. Jennifer, you didn't hear my act like an adult rant. Technically okay, so here's the thing, guys. C is technically not a wrong answer, but what is more professional, right? I actually had this exact thing happen to me. More professional, decline the request and explain professional boundaries. But C isn't necessarily wrong. You could do that, but is that professional? Is that acting like a professional? Not really, like ghosting and just not explaining and communicating things, right? Plus, it could damage the therapeutic relationship if you just ignore them. And then they get home and they're like, why'd they decline my friend request? And then they get in their head, right? Maybe they really don't like me. Like,
Wait. I'm sorry. Hold on. Are we on number 5? I was looking at number 6.
Yeah, no, it's number 5.
I'm so sorry. I didn't answer number 5.
Yeah, I'm going off on a tangent about number 5 right now, but this is the way that I'm thinking about it, right?
My
Like,
apologies. I picked B for number 5.
okay. Anyways, I believe my tangent has truth to it because I just feel like ignoring it is unprofessional, right? And it could cause more harm than good. And then also, if you're ignoring something, like what are we teaching our client? To just ignore things and not communicate, right? So, and D is also correct too, right? Create a separate professional profile for client interactions. That is also technically correct. I think you can do that. But what is the immediate more correct answer of what we should do, right? That's going to be B. I think everybody mainly got it right too. Okay, if y'all feel like I'm wrong in any way, speak up. 6, a counselor discovers that their client is also receiving services from another therapist. What is the best course of action? A, contact the other therapist and coordinate care. B, terminate services to avoid duplication. C, discuss the issue with the client and seek consent to communicate with the other therapist. D, continue sessions and avoid interfering with the other therapist.
B.
It's actually C, you guys. So I want to give you some perspective on this. I feel like the question kind of sucks, but so the answer is C, and let me tell you why. For example, There's a therapist in our office that does EMDR, like he primarily just does EMDR. So people will come to him just for EMDR, and then they have a totally other regular therapist that they see. And that's 100% okay. People even write, and like ask, I just want to come there for EMDR. I already have another therapist. That's not what I'm looking for. I'm just, yeah. Right, Nancy, you need to find out what kind of therapist. We really need to know more about, more details, right? But in generally speaking, that is okay. Or someone, actually something else that's coming to my mind right now. Like someone that has a, eating disorder therapist, right? And a regular therapist. Like, well, that's not our specialty. That's a more honed in type of care, right?
Yeah, I had that happen to me, Tessa. One of my clients was in family therapy with her daughter because she was in she was actually at a center for anorexia. So she had a family therapist and then she came to see me.
Yeah,
The
and
mother, the
also
mother did, yeah.
100%. And also, I don't remember who told me this, someone recently, that if you can't go to two therapists and treat the same thing. So I can't go to two of you and seek help for my depression from two different therapists. But if it's a different thing entirely, it's totally fine. Okay. I feel like maybe these are the ones that I did the other day. I'm sorry, you guys. I have so many quizzes that I make that I get confused, but I did add more. A client's partner contacts you to ask about their counseling progress. How should you respond? A, provide general information to ease their concerns. B, refuse to provide any information without client consent. C, schedule a joint session to address their concerns. D, ask the client for permission to share their progress.
B.
Yep, good job, you guys. The answer is B. Okay, cool. Let's look at number 8. You are asked to testify in court regarding a client's treatment. What is your first step? A, provide a detailed report to the court. B, consult the client for consent to disclose information. C, seek legal advice before responding. Or D, decline to testify due to confidentiality concerns. We went over this the other day, so yeah, it is C, you guys. It is C. Somebody else too chimed in the other day and said that your liability insurance gives you free legal advice. I don't just.
That
fun
was
fact.
me.
Yeah, thank you. Yeah, that's interesting to know. I'm sure I'm gonna use that. Unfortunately, we're all gonna probably find ourselves in this situation. Okay, 9. A client offers to pay for sessions by performing services for your practice. What is your response? A, accept the offer to help the client afford sessions. B, decline the offer and explain the ethical concerns. C, negotiate the terms to ensure fair compensation. Or D, refer the client to a counselor with a sliding fee scale. So it's definitely not C, guys. Kaylee, I think you chimed in earlier about last time about this. Can you do it again? 'Cause I think it was you.
Yeah. I'm trying to remember what I was.
I think we talked about it last time. And it was like if the client is performing services at your practice, they're like an employee. So then it's an employee and your client, which is like a dual
Yeah, that's a
relationship.
dual relationship for sure.
Yeah. Does everybody see how that's a dual relationship? B, a lot of you did say B, so good job. Yes, okay, good. Cool. A client expresses frustration with their current therapist and asks you to take over their care. What should you do? Accept the client immediately to meet their needs. B, contact the current therapist to coordinate the transition. C, explore the reasons for their dissatisfaction and suggest they address it with their current therapist. D, decline to work with the client to avoid ethical complications. That's actually funny that this question came up because I just had this happen the other day. What do y'all think? This one seems a little bit like broad to be on the test too, but hey, here we are. Yeah, I don't know if I like this one, you guys, but technically the answer is C. I think we need more information though, in my opinion. What do you guys think?
Yeah,
Yeah, that one kind of sucks. Moving along.
I can kind of see why it's C though.
Yeah, I mean,
Because I guess because that's what I chose because we don't know exactly what they're trying to seek from their therapist. So you don't want to go in and, accept them. So, and then you get the contact the therapist. We don't have a consent. So I kind of just did elimination to get to
Yeah.
C. But
Yeah.
I can see it.
Yeah, I feel like the questions again are not as, I try to make them more confusing than the test, and that one's definitely that one would be one where you're like, okay, which answer is better, right?
Right.
So it gets your mind in that habit for sure. Also, we need more information. I feel like, do we need to, like, is the other therapist again like the eating disorder therapist, and we're the general therapist? I feel like we need more information. Okay, number 10, you're out of here. We're working on number 11 now. A counselor receives a gift from a client after a particularly emotional session. What should the counselor do? A, accept the gift without hesitation to avoid offending the client. B, refuse the gift and explain the ethical guidelines. C, consider the client's intent and the value of the gift before deciding. D, accept the gift and document it in the client's file. Yep, good job, you guys. I feel like we did this one the other day, so good job, C. We're not automatically just going to decline the gift, you guys. We're seeing like the situation, what their intent was. Also, it says in the ethical code, if like something along the lines of, don't quote me on this, like if giving gifts is like a cultural thing, like we would accept the gift.
Tess,
And
I have
there's
a quick question.
Okay.
Why, I understand why it's C, but why wouldn't it be D? Could you explain that?
Except consider the client's, okay, so technically D is a correct answer, but which is more correct, right? Because if we're just accepting the gift and just grabbing it from them, thank you, setting it on our desk, whatever. I feel like we need to wait, why are they giving me a gift? Like, are they giving me a gift because they like me romantically? Are they giving me a gift because they're emotionally charged right now and they're just, I don't know what they're needing, right? Because it said that it was an emotional session. We need to understand the intent behind the gift before we accept it. Can someone else help me explain that? Anyone?
I think also something is like a cultural aspect. I know in some some cultures that's just like what they do, and so for instance it can help the therapeutic relationship by accepting the gift or figuring it out, and if it's like a low monetary value, I think that's what we're talking about.
Yeah, I just feel like without accepting it just blindly and not understanding what their intent is the key missing thing here. Again, I don't think D is wrong. I just think C is more correct.
Okay, thanks.
Yeah, so again, that's welcome to the NCE, guys. Like 1, 2 can be there. In fact, somebody pointed out to me before I took the test. They're like, yeah, I took the test and every single question, 2 of them were correct. I had to pick which one was better. I would say my recollection of taking the test, at least 50% of the questions were like that. Where like 2 were right, you just had to pick which one had a little extra detail or a little less detail than was needed, right? Hopefully that helps. Yeah, and Nancy says ulterior motive, yeah. 12, you are supervising an intern who discloses that they are struggling with personal issues affecting their work. How should you proceed? A, terminate the supervision relationship. B, refer the intern to personal counseling services. C, allow the intern to continue without addressing the issue. D, discuss the issues and provide additional training. What do y'all think?
I picked B.
Yeah, we went over this the other day, you guys. Some of you were on. The answer is actually B, because remember, you're not really supposed to, it talks about this in the ethical code, so please read it, right? But you're not really supposed to, like, as a supervisor, like be their counselor as well, right? if they have personal issues, like maybe scratch the surface, but you shouldn't be sitting down and having a therapy session with your supervisor, right? It's trying to get you to see to keep work and personal life separate. Does that make sense? Especially the term you're supervising an intern. Like, as tempting as it might be to like sit down and be their counselor, that's not what you're supposed to do as a supervisor. You're supposed to refer them where they can get help for their personal issues, right? And you're supposed to see them in a professional setting. Like, how can they be? I'm supposed to watch them and making sure they're at their best for their clients. Does anyone have any arguments against other? Because I see some of you guys are saying D. This is my mindset with D. I don't like additional training. I don't know what training they would need. I don't know. I just feel like B is better because it says in the question they're struggling with personal issues, right? So I don't know how like on the job training, our training would be like on theories, our training would be on like how to be a better counselor, but I don't know that the training would address their personal issues. That's where my mind goes. Please, somebody speak up.
Hey Tessa, I agree, because I was going back thinking that as a supervisor, you have your supervision and you talk about the client and then you talk about your professional identity. And those are the two things that you're talking about with your supervisor. If it's something personal, then they need additional help.
I mean,
Is-
I think you can obviously, we're human, right? And
Yeah,
I actually had a day months ago where I had to call my supervisor, like, hey, I'm just mentally, like, I just need a day off right now. And I'm sorry for any inconvenience. I just mentally am at my capacity. I didn't go into any more details to her. I just
Right.
said that. And she didn't ask. And she said, you know what? I thank you for advocating for yourself. Absolutely. You have perfect attendance. Not a problem. We'll call your patients. Right. So, but like, I'm keeping the relationship professional. I didn't dump all of my stuff on her. And if I was trying to, I think she's a supervisor, she probably would have said, you need to probably seek out a therapist, right? So again, guys, visualizing the scenario actually playing out helps me to answer the questions. Everybody good? All right. A client in group therapy discloses they are being abused by their partner. What is your ethical responsibility? A, maintain confidentiality and support the client within the group setting. B, report the abuse to authorities. C, discuss the situation privately with the client and provide resources. Encourage the group to address the issue collectively. What would be the best answer, you guys? I think we worked through this one the other day too. The answer is actually C. Why do you guys think, can someone tell me why they chose A? So remember, guys, we're also not talking about, it doesn't say that it's a child. We would have to report it. I personally think, Tazbil, that you're being like, that seems a little extreme, that you cannot continue helping the client, because I personally have a lot of clients, not in a group setting, right? Actually, yes, in a group setting. Absolutely. Absolutely. What am I talking about? I had this exact scenario like 6 months ago. And I did exactly this. I pulled the person aside, told them I did suggest they seek one-on-one counseling, and I did give them resources for like women's battered women's shelters and stuff. And turns out they ended up getting individual counseling. So obviously, the reason I don't like A is just because it says maintain confidentiality. Well, like, I would hope so, right? And support the client in the group setting. I don't feel like it's breaking confidentiality to pull them aside afterwards and give them resources. No one's saying anything. What do you guys think?
I agree with you, Tessa. I think the key here in this situation is it's a private matter. It's not, it no longer is a group matter. You have to take that person aside and provide resources so they can get help. Yeah.
Okay. Yeah, okay. I just want to make sure my mind was thinking correctly. Because sometimes AI does get the answers confused, but I do feel like that one's right, you guys. Okay. 14. And Tasbil, I saw that you were accidentally doing 14, no worries. A counselor begins to develop romantic feelings for a client. What should they do? You guys, let's make sure we get this one right. A, terminate the counseling relationship and refer the client to another professional. B, continue the relationship while maintaining professional boundaries. C, disclose the feelings to the client to maintain transparency. D, seek consultation with a supervisor or colleague.
Pass right off the back. I am between A and D.
Yeah, I personally feel like we know that we have to do something. We got right, you guys? If I were
Right.
in this situation, and it's crazy because, you know, these things we read, we're like, oh my gosh, this will never happen. It will, you guys. Like sometimes we cannot, I mean, maybe not will, but it could. Like I know in my life, to be a little personal here, like sometimes I'll get crushes on people when I've like, why am I having a crush on this person, right? Like they're my coworker. I just ignore it, but still the feelings come up sometimes, right? We're human. And honestly, the answer is going to be D, and that's exactly what I would do. I would get anxiety and tell my supervisor, like, I'm feeling like this person reminds me of someone I used to be in love with, and these feelings are coming up, and I don't know how to address it. I do know, guys, that we do not tell the client because that could cause more harm. Because then they're not going to trust therapists going forward, right? I really don't feel like we would ever tell the client we have feelings for them. That is, to me, that seems super unprofessional and it could damage them, but you know, we don't know what they're going through. I feel like that could damage them more. So I feel like for me, and you're gonna see a lot of the questions on the test, and I chose a lot of answers that were like, I would seek supervision from or seek consultation with the supervisor. We definitely don't want to do B because that can the counter transference that can be damaging because you're not able to really show up therapeutically when you have these romantic feelings, right? And A, we do not terminate the counseling relationship and refer them to another person. I just feel like that could be correct, but I feel like we should ask a supervisor first how to go, because it's kind of, I don't know if I want to say our fault, but maybe the supervisor can say, hey, we can just transfer them to the counselor in the room next to you, so they don't have to go to a whole nother place. We just terminate them, send them off. I don't know. I feel like I am torn between A and D, but I feel like D for me is what I would personally do when put in that situation of how to handle it, because I would make sure any communication that comes out of my mouth to that client is not like clouded with this vision of my feelings for them. Does that
I
make sense?
agree. I agree. Like you said with the, if you're in a private practice, you could just refer them to another therapist instead of refer them to a whole nother
Yeah.
business.
Because
So,
when you have those romantic feelings, it clouds your actual like logical judgment. We all know this from our personal lives, right, you guys? So I feel like any type of communication going forward after I realized I have these feelings, I should get someone to help me, you know? Yeah, we definitely don't do C, you guys. I know, I just know intuitively would not do C. It could damage the client even more. And then they don't trust any therapist after you, and they're not getting the help they need because they think all therapists are gonna crush on them or something. If I'm wrong, yeah, yeah. That's how I feel about C. I feel very strongly that we would just never tell them. Okay. A client has difficulty paying for sessions but wants to continue. What is the best course of action? A, offer sessions for free until their financial situation improves. B, set up a sliding scale fee to accommodate the client. C, refer the client to community counseling resources. D, terminate the counseling relationship due to non-payment. I think this is the one the other day that we don't like, but we're gonna work through it. Yeah, the answer is B. I think we all remember that from the other day, but does anyone, I guess a more correct answer, how we handle it where I work now, is all of a sudden if someone can't afford or they lose their insurance, the sessions are $125 a session. So the place where I work, the lowest they go is 85. So I guess in my mind, you would offer them the 85. If they cannot do that, then you refer them to community counseling resources, right, guys?
Right.
So we always want to give them an option, right? Even if, I mean, technically it's sometimes not up to us individually because I work for somewhere. It's up to them, not me, right? I cannot say what sliding scale is. So yeah, again, it is B, and then if that doesn't work out, then C. And you definitely don't do D. And you definitely don't have to do A, right? Although some places do offer free sessions with interns and stuff. You suspect a colleague is under the influence of alcohol during sessions. What is your ethical obligation? Report the colleague to licensing board immediately. B, confront the colleague directly and offer support. Document your concerns and consult the supervisor. D, avoid involvement to protect your professional relationship. Yep, it is B, you guys, you go directly to them. I feel like you should go directly to them first of all, because like, do you know that they're really under the influence of alcohol? You can't just go telling on people like before you actually address it to them first, right? And give them a chance. It just says suspects in the question. So wouldn't that be horrible if you're documenting it, then you're telling people and you haven't even talked to them directly? I guess that's my little thing about being an adult, right? Okay. A counselor receives a subpoena for client's records, but no client consent. What is the appropriate response? A, provide the records as required by law. B, refuse to release the records to protect confidentiality. C, consult with legal counsel before responding. Or D, notify the client and proceed with consent. Yeah, it is C, you guys. I think you're probably gonna have to do A, right? But C, get legal help or supervisor, whatever, counsel before responding. Okay, a client expresses they are dissatisfied with your services and wants to see another counselor. What should you do? A, offer to address their concerns and improve your services. B, support their decision and provide appropriate referrals. C, terminate the relationship immediately and document their dissatisfaction. D, attempt to convince them to continue counseling with you. This goes back to you guys when people say, what I studied was not on the test. Well, okay, if you studied the ethical terms of autonomy, this would be an application question, right? For autonomy, we're going to support their decision and provide appropriate referrals. Not everybody is for everybody. And plus, you should be empowering them to be an advocate for themselves and find someone that they can mesh with, they can be vulnerable with, they can open up to, they can, you want them to be in a place that fosters their healing, right? So we don't, and plus we don't take things personally. So
Well-
yes, B.
Well, why wouldn't it be A?
I don't, does
A
anyone
would
else
be a
want to
better
chime in? Because if, so basically they're dissatisfied with your service and wants to see another counselor, what should you do? That's a good question. What do you guys think?
I go back to what you said about anonymity supporting their decision because I don't know. I feel like A is kind of like improving your services. What if you can't improve your service? Because if they're just dissatisfied, I don't know. I feel like A is kind of like,
A kind of
You're-
feels like you're trying to convince them of something.
yeah, that's what I was just about to say. It feels like you're
Yeah,
trying to
that's what it
convince
feels
them
like to me,
instead of
Justin.
supporting their decision. Because it is their decision. Yeah.
That's my
So are
mindset too.
Are we assuming in this thought experiment that they've already decided to see another counselor?
I think, yeah, we are. Like they're
So-
letting you know, I'm not happy with our relationship, this therapy session. I want to see another counselor in the office. And
And
actually,
sometimes
that actually happened.
personalities don't mix. Sorry. Like I had this happen to me and they didn't want to see me anymore because I'm a Christian and it was just clashing and I never brought my religion into it, but she felt like because she knew I was a Christian, she saw it on Psychology Today, she just wanted to see somebody that was non-spiritual or religious. Personalities sometimes just don't match.
For sure. Yeah, I feel like it's what I said. We just want to support them and advocate for them, right?
Right? Yep.
At the end of the day, they know what's best for their own life.
Exactly.
I feel like it's tempting to do A, like if we were to get like defensive, right? Or take it personally. But if you're truly in
Oh.
this mindset and that was the best advice someone ever gave me, even the first day of my practicum, they're like, I want to tell you something, Tessa, that I wish someone would have told me my first day. Do not take things personally.
Yeah.
Um,
No, but A does not seem like I'm taking things personally. I feel like that is the professional thing to do to really truly try to understand what their concerns are so I can address them, professionally, not take it personally, but
Yeah.
Improve as a counselor. That's
I
that's the reasoning.
I feel you. Yeah, like this is why the ethics, and you guys, if you actually try to look for a black and white answer in the ethics, you're not going to get it. You guys do know that, right? Like, it's impossible. Everything's just very gray area, and you need to make the ultimate decision. But I feel like what the test would want is you to focus on that ethical term of autonomy. But you bring very valid points, you guys. Something to think about. All right, you discover a group member is sharing confidential information about other members. What should you do? A, remove the group member immediately. B, address the behavior during the group session. C, discuss issue privately with the member and emphasize confidentiality. D, terminate the group to protect remaining members. Yeah, the answer is C. People make mistakes, right? But it's just important we address it, bring it to their attention, and then moving forward, they understand there could be consequences, right, if they continue to do that. Okay, a client's parent requests to attend their minor child's counseling session. What is the best course of action? A, allow the parent to attend and participate in all sessions. B, refuse the request to protect the child's confidentiality. C, discuss the request with the child and involve them in the decision. D, schedule a separate session to involve the parent.
C.
Yeah, it is C, you guys. This exact thing happened to me. And the child told me that they wanted one session with their parents and then they just to work some stuff out, and that was okay. But if the child would have told me, you know what, I don't want my parents to come in session, I'm not ready for that. Or I don't want it, I don't really know what I would have said, but probably would have requested, I probably would have told the parents they needed to seek a family counselor, right? Because the child is your client. Does anyone have any other thoughts on that one?
Question.
Yeah, I mean, I could try to answer.
At what point does the parental authority override confidentiality, or does it ever or never?
Would it be if
that-
they're harm to themselves or
Yeah.
others?
Yep, that is correct.
That's the only
Okay.
time.
Yeah, it's the
Okay.
same type, believe it or not, you guys don't overthink it. Like, you just assume because they're a minor, you have to tell the parents everything, but then that damages the therapeutic relationship, right? But at the end of the day, the unfortunate thing, Justin, and I've seen this happen in private practice anyways, the parents can go and request all the notes. Because their child is a minor, they can pay the fee and get the notes. You know what I mean?
Right.
So it's like,
So-
do you tell them? Or do you just let them go get the notes? Well, if it were me personally, I would tell them, look, like, the goal of counseling is so your child has someone somewhere safe, a third party, an unbiased party, right? That they can open up to. So they're not going to feel like they can open up to me and trust me if I'm telling you everything they're saying. And once you tell them that, I've actually had this exact scenario come up. They're like, oh, I didn't think of it that way. Yeah, you're right. I don't want to know. I only want to know if they're like going to harm themselves, right? And you assure the parents that I will let you know if I think of there's whatever, if they're suicidal or they cut themselves or whatever. I will absolutely let you know if I think that there's something concerning their safety, right? That I will address with you. That's how I was taught anyways. What do you guys think?
I mean, I agree because like you said, with the adolescents, you want to maintain that confidentiality and have them, disclose, because some adolescents think adults don't understand anyway, or they may be skeptical and think you're going to tell anyway. So I agree. And then when you explain it to the parents, they will be like, oh, I didn't think of it like that. So, I mean, I agree with you, what you said.
Yeah. What do you think, Justin? Did that help you a little bit?
Yeah, no,
Hopefully.
that's clear. Yeah.
Yeah. Okay, that's all I got, you guys. I feel like we did this one the other day. I probably pulled up the wrong quiz, but anyways, we'll have another one to do next time. Does anyone, happy Thanksgiving, everybody. There's 20 of you that showed up for yourselves on Thanksgiving. And Nancy says, Dr. Pam says the same thing about being on the stand. Can you tell us what you mean, Nancy?
Like if it's court ordered and you're on the stand, she had said, if they say, well, tell us details about blah, blah, blah. And Dr. Pam says, well, I don't want to break that relation, the therapeutic relationship. If you do that, if you are forcing me to say something, while I'm on the stand, you're going to break the therapeutic relationship that we have. It's just a thought.
Yeah, for sure. All right, you guys, thanks for showing up, everybody. I hope you all have a good Thanksgiving.
Thanks, Tessa.
Yeah.